Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Duchenne muscular dystrophy and Becker's muscular dystrophy. Both of them are X-linked recessive disorder that affect predominantly male children, caused by mutation of large structural protein called dystrophin. Symptoms appear by 5 years in Duchenne muscular dystrophy or DMD. A DMD patient or Duchenne muscular dystrophy patient becomes wheelchair bound by 12 years and dies in late 20s, maybe in early 30s. The incidence of Duchenne muscular dystrophy is about 1 in 3,500 male live birth. Symptoms appear by 12 years in Becker's muscular dystrophy. The Becker's muscular dystrophy is less common and less severe. Okay, so this is the histopathology of Duchenne muscular dystrophy. We have problem of the protein called dystrophin protein. So that dystrophin protein is very essential for the action of the muscle and also for signaling inside the muscle. So what happened? This in muscular dystrophy, we will look at the histological feature. These two are the slide of a 3-year-old boy, and that is the slide of a patient of his brother at the age of 9 years. Okay, and younger age fascicular muscle architecture is maintained. Okay, so here muscle fascicle are maintained nicely here at 3 years of age, but myofibers show variation in size. So one is small and other is large. Okay, we are saying that. Additionally, there is cluster of basophilic regenerative myofibers on the left side. These are the regenerating myofibers. Okay, we have some degeneration and compensatory regeneration. There is continued here, but eventually there will be degeneration and slight endomysial fibrosis. We have fibrosis around the muscle, endomysial fibrosis, seen by focal pink staining connective tissue between the myofibers. Okay, we got that here. Okay, immunohistochemical staining shows complete absence of membrane associated dystrophin. So dystrophin connects the cell skeleton to the cell membrane, so it help in contraction of the muscle, okay, and also essential for signal transmission. So at the cell membrane there is no dystrophin. This is normal cell, and this gray area, this gray area are the along the cell membrane or the sarcolemma of the muscle here, and these are the protein. There is the dystrophin. This dystrophin is absent here. So dystrophin is absent in Duchenne muscular dystrophy. Okay, so complete absence of membrane associated dystrophin. Membrane means the cell membrane. Here it is the sarcolemma, the cell membrane of the skeletal muscle cell here. Okay, dystrophin is also present in cardiac muscle. Dystrophin in a normal cardiac muscle, it is also present in the peripheral nerve. It is also present in the brain. Okay, so we got that. The biopsy from the older brother illustrates disease progression, which is marked by extensive variation in myofiber. One is small, one is large, and some muscle, there is some necrosis here, degeneration here, replaced by fatty tissue. These are not empty spaces. These are fatty tissue. Okay, so muscle is replaced by fatty tissue. We'll find out it will lead to pseudohypertrophy. Okay, so extensive variation in myofiber size, fatty replacement, and endomysial fibrosis. In the endomysium, we have a lot of fibrous tissue develop, fibroblast. Okay, and we'll get the fatty replacement here. This is the fatty replacement. Fat is coming here. Okay. Duchenne muscular dystrophy and Becker's muscular dystrophy pathogenesis. Mutation of the gene on the short arm of X chromosome XP21. This is one of the largest gene of the human body. Okay. Dystrophin forms dystrophin complex. It complex with the glycoprotein, complex with that of the glycoprotein, and is essential for stabilization of muscle cell and involved in cell signaling in a normal cell. Okay, so it forms a complex. What? The complex is the dystrophin complex. Okay, we got there. Okay, so dystrophin will make a complex here. Okay, so here we'll get complex plus glycoprotein. Okay, we'll get glycoprotein and dystrophin complex that is essential for stabilization of muscle cell and involved in cell signaling in a normal cell. Okay, so what happened? Defective or absent dystrophin causes tearing of cell membrane, and there is repair, but tearing is more than that of the repair, with influx of calcium and destruction of myofibrils. Okay, that is the pathogenesis. Okay, so we have absent dystrophin. Absent dystrophin means there is no complex with glycoprotein of the cell membrane. So there will be cell damage and there will be repair, but repair is less than that of the damage. Genetics, deletion or frame shift mutation in Duchenne muscular dystrophy with absence of dystrophin. Here, almost totally absent here, dystrophin. But point mutation in Becker's muscular dystrophy with residual and defective dystrophin in case of Becker's muscular dystrophy. So this is mild form, this is the severe form of muscular dystrophy. Okay, so we go to the clinical feature. Toe walking, waddling gait because the proximal muscle around the hip joint is weak initially, then around the arm will be weak. Inability to stand from supine position, and the patient uses their arms to climb up their bodies. That is called Gower Sign. Very much characteristic for Duchenne muscular dystrophy. Muscle weakness, disability, and pseudohypertrophy of the calf muscle. We have two muscles, gastrocnemius and soleus muscle. These are called calf muscle. These are present at the back of the leg, okay, just below the knee joint, okay. So there will be replacement of the muscle by fatty tissue and connective tissue. We call it pseudohypertrophy of the calf muscles. There will be cardiomyopathy, okay, again because of dystrophin absence in the heart, arrhythmia, and heart failure. Cognitive impairment and mental retardation. The pathology in the brain is not very distinct, but it is told that there will be lack of dystrophin in the neurons in the cerebral cortex, lead to cognitive impairment and mental retardation. Respiratory muscle weakness is a very common feature, especially in Duchenne muscular dystrophy. Cognitive impairment is not seen in Becker's muscular dystrophy. Respiratory muscle weakness is also not very obvious in Becker's muscular dystrophy. Death results from respiratory failure, pneumonia, or heart failure. Death from Becker's muscular dystrophy, also from heart failure. And person with Becker's muscular dystrophy can survive in their 40s. Okay. Duchenne muscular dystrophy usually dies in late 20s or early 30s. Okay. So these two images I have taken from the Microsoft PowerPoint online pictures. This is the Gower sign. A child cannot stand from this position, okay, or from the supine position cannot stand up. Okay, here when he like to stand, then he should climb on himself or herself, so that way they can stand. This is Gower sign, a very important sign for muscular dystrophy, specifically Duchenne muscular dystrophy. Okay, maybe also in Becker's muscular dystrophy. We'll also have pseudohypertrophy of the calf muscle. These are the calf muscle. This is not muscle. Eventually, the muscle will be replaced by the fatty tissue and connective tissue. Diagnosis and treatment. Diagnosis, history and physical examination, like Gower sign, pseudohypertrophy of the calf muscles. Serum creatinine kinase level should be high in the initial decades, but in the last stage when muscle will be atrophied entire muscle body, then we may not get high level of serum creatinine kinase. And definitive diagnosis is muscle biopsy. This is very important. Okay, muscle biopsy. Treatment is very challenging. Actually, there is no treatment for Duchenne muscular dystrophy. Okay, treatment is supportive care, genetic counseling, supportive care for anything, for cardiac function, for respiratory function, for muscular function, like physical therapy, maybe sometimes occupational therapy. Genetic counseling is very important because it's an X-linked disorder. So every possibility to transmit to the next generation, especially to the male child, but female child will carry that disease usually because they have allele, they have two X chromosomes. So female usually they don't suffer, they carry the disease, the Duchenne muscular dystrophy. Steroids with short-term benefit may make the patient little bit ambulatory. He can walk by steroid, but steroid has a lot of adverse effect like moon face, buffalo hump, central obesity, and also many other like that of the cataract, hypertension, aggravation of diabetes. Usually prednisolone is given. It gives some short-term benefit of ambulation. Person can walk. Okay. Gene therapy to restore dystrophin. Okay, this is under clinical trial. Success has not been established, but idea is that to restore dystrophin. That is the reason for this type of muscular dystrophy. And that's all about the Duchenne muscular dystrophy and Becker's muscle dystrophy. Okay, so Duchenne muscular dystrophy is very severe form and early death. Becker's muscular dystrophy person can go beyond 40 years and symptoms are mild. Usually there is no cognitive dysfunction. Respiratory function is not also disturbed in Becker's muscular dystrophy. And that's all for today. If you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me. Have a nice day. Bye now.